Next up, Patient Advocacy by Dr. Juliette and Clare Stacey.
Good afternoon, everybody. It's wonderful to be here. I'm Juliette.
And I'm Clare. I'm a patient with Vascular EDS with a confirmed diagnosis, and I'm taking a lead on the emergency care project. So that's looking at trying to improve outcomes for patients when they're hitting emergency care services. And I'm leading the working group, which is a group of carers, patients, people with Vascular EDS. We've got people from the EDS service and also representatives of Annabelle's challenge. And one of the things that's highlighted during this project is the importance of self-advocacy, how particularly for rare disease patients that's really important in getting yourself heard, not just in the event of an emergency but in day-to-day life as well.
So we wanted to know the experiences of people, and last month Annabelle's challenge kindly sent out a survey link to find out your top tips and advice. So thank you. The nuggets of wisdom and the stories and the experience that came in were amazing, and we're going to feed this back to you today. And so why have we called it a workshop? It's because it's a work in progress. We are always learning, and we really hope that at the end of the workshop you will fill out a form that I've left on your tables so that we can learn from you as well. So what did we learn? We learned that there are 5 main areas that you felt influenced your ability to be good self-advocates. Self-advocates to get yourself heard and get your needs met. And we'll go through these one at a time today. So there's learning, to have good self-knowledge, to have good routine medical care, to be prepared in an emergency, and to take care of your mental and physical well-being. So in terms of learning, what did you tell us? You told us repeatedly, many people told us that knowledge is power, and we keep hearing this over and over today, that knowledge is power. You said to educate yourselves, because many doctors and people will not have heard of vascular EDS. And you said to learn from others, so you can learn from their experience, and to share your knowledge with others so they can learn from you, including healthcare providers and people with vascular EDS. You told us to learn about your own bodies, to learn about and to listen to yourself, to learn your limitations, your triggers and your symptoms, to learn how to self-manage, to learn to adjust, and very importantly, to learn when to seek help. You told us where you learned from, which were your sources of information. So the bigger the size of it, the more of you learned in that way. And we can see that Annabelle's Challenge, Ehlers-Danlos Support UK, EDS Service, amongst all of these other fantastic sources of information, is where you got your information from. Really importantly, you said to learn only from trusted sources, not just to randomly Google. Regarding the EDS service, one of you wrote to me, the EDS service has been brilliant, really reassuring. It's really good for us to know that we can contact them about an issue, any issue, and they'll get back to you and then make sure you're okay. And then they'll follow up with you. This makes us feel incredibly supported. You told us that the charities, and in particular, we have Annabelle's Challenge, EDS Support UK, EDS Society, and other charities, have been incredible sources of information to you, and that they have helped you in the following ways. They have helped you connect with others. They've recommended you VEDS specialists. They've answered your questions. They've updated you with new developments. They've given you emotional support and offered practical advice and resources. They've listened, and they are, as I said, a reliable source of information. And so I want to introduce, I'm going to have Elizabeth and then Jennifer, who will tell their stories with you about connecting and what the charities need then. Elizabeth.
Hi everyone. So I got diagnosed 7 years ago, and the first few years it was the genetic counsellor Clare Green that really helped me massively. She answered all my questions, ringing me constantly, helping me through my breakups and everything, just helping me get my life back under control. But in the 7 years it's definitely been Annabelle's Challenge that has massively helped. Not only have they answered all my hundreds and hundreds of questions, no matter how small or big, they've also, even if they don't know the answer, they haven't just given up. They've found other people with patients that they've connected me to and helped me figure out the problem that I've been having. But one thing I've realised that it's all about me. It's all about learning my body. It's all about learning what I can and cannot do and my limits. And between that's what's been helped me and feel like I'm living my life and not just surviving anymore. Thank you.
Hello, good afternoon everyone. My name is Jennifer and I would like to share with you the difference that Annabelle's challenge has made to our family. My son and I were diagnosed roughly 12 years ago, and at that time although there was a genetic counsellor in the room with our results, we were then provided with no support, advised there's no treatment options, and really just not to dwell on what you would read on the internet, but just to make the best of things. And when you're a parent faced with that, that's not good enough. So we, myself mostly, began a process of reading through all the medical stuff available online, and I'm sure a lot of you will realise that it's not great reading. A lot of it is based on worst case outcomes. So it was through that process of research that I became aware of the charity Annabelle's Challenge. And our turning point was when we attended the last conference. My husband and I travelled over, and as you can tell from the accent, I'm not from these parts, and we managed to meet up and connect with another family who are from the north and, as it turns out, don't live too far from us. So we were able to chat with them how they were coping as a family and make friends. It was the first time that we've been in a room with patients like ourselves. It's the first time I'd ever laid eyes on anybody else, because I think there's only 4 of us in the north with it. They're quite small numbers. It was from the challenge, Annabelle's Challenge, that we were made aware of the medical treatment available, particularly the EDS Centre in Sheffield. It was where that we learned what as patients we should be asking for. We didn't realise that you could put an ambulance marker on the house. We didn't realise that treatment options, and whenever we finally went to Sheffield, we were able to talk to someone who knew what we were talking about. But as I'm sure you're aware, whenever you live with this, it's not just the medical side that you need answers with. We were faced as a family with how do we deal with the day-to-day, particularly when you're raising a child with this. We had lots of problems. How do we get travel insurance? Can we take a long haul flight? And it was so refreshing to talk to someone who, as it turns out, had returned from a long haul holiday, and she had a great time, and we realised that yes, we can live with this, and yes, there are people out there who know what we're talking about. And I do have to mention, just as a thank you to the Sheffield Clinic, the little blue card was a lifesaver for me quite recently, so thank you for that. And had we not attended Annabelle's Challenge conference, we wouldn't have been aware that that even existed, so that for us made a big difference. Recently my son has started university, and Annabelle's Challenge has provided a reference point. He was able to ask questions about vaccines actually, and he was able to confident to contact the charity to say, I have this relatively minor question, and the charity were a great support to him. And I think for him to know that he has a reference point for someone who knows what he's talking about has made all the difference in how he copes with this. So Annabelle's Challenge really has been an absolute game changer for us. As a family, we are facing an uncertain future, but we know that we have the support of Annabelle's Challenge, and we don't feel that we're facing that future alone anymore. Now, as a family, I would like to pass on our admiration and thanks to Jared and his family, because without his input, we would be in a very different place, and I really think you've made a difference, certainly to our lives and many. Thank you very much.
Thank you so much, Elizabeth and Jennifer, for sharing your stories and how you seek support and learn for yourselves. And I want to finish with a quote about this learning section, just one quote, and this came to me. It said, "That I learned most from sitting in a room with similar age people at the Berry conference and sharing stories." So So for you who are here today, you're already on that pathway to learning and increasing your self-advocacy through learning. So thank you for being here as well. So to my next theme, being a self-advocate within your routine medical care. So when you sent your survey responses to me, you talked about your medical care, your routine care, developing a really good working relationship with your GP and your healthcare providers. And this is what we as healthcare providers want as well. And again, this theme over and over again, to educate yourself and to educate others, because vascular EDS is so rarely known of. You talked about just being good patients, making sure you keep your appointments, keeping to your scans, accessing any referrals that are available to you. You talked about keeping immaculate, note-keeping medical records, keeping your medical records in files and keeping them in one place. And also, many of you now have an app on your phone that you can keep medical records in there so you can pull them up at any time. Some of you talked about needing to access your trust's PALS, Patient Advisory and Liaison Service, when you needed some more support or involvement with your healthcare providers. But it seems, after all this, that being a good self-advocate in terms of routine medical care is about standing up for yourself, but also being an exemplary patient. So I've just finished this section, this theme around being a good self-advocate through routine medical care, and I'm going to pass it on to Gemma, who's going to talk to you about emergency preparedness. Thank you, Gemma.
Hello, I'm Gemma. I've got a diagnosis of vascular EDS. And I'm going to be talking about preparing yourself for emergency situations. I'm also a doctor. I'm currently training to be a GP, and I've worked in A&E as part of my training. As Juliette and Clare have said, from the patient survey, one of the main things that came up about kind of preparing yourself for emergency situations is the importance of being your own advocate. And a great way to start with this is learning as much as you can about VEDS as a condition, as well as how it affects you specifically as an individual. This can be really difficult. There's a huge variability between people who are diagnosed, even within families. So it's important to get to know your own body and how VEDS affects you, and what's normal and abnormal for you. As already mentioned, it can be difficult reading all about VEDS, as you'll inevitably come across the worst case scenario, which is never a nice thing to think about. And the nature of VEDS means that we can't predict if or when we're going to have a serious event. So it's kind of a balance between kind of preparing yourself for the worst, but also not letting it overtake your life. VEDS can present in all different ways, and it can be hard for both us and clinicians to decide what's serious and what isn't. So I would say it's best to have a low threshold to seek help if you're worried about something. From a clinician's point of view, we'd rather you came to see us and for everything to be normal than leave it and for you to be worrying about it. Don't let previous negative experiences with healthcare professionals put you off seeking help again in the future. And most clinicians are open-minded and willing to learn about rare diseases they might not have heard about, and arming yourself with as much knowledge and information as you can is a great way to get your point across. Using all the resources as previously mentioned to learn everything you can about VEDS, seeking support from Annabelle's challenge and other people in the community, I think is also really important. Thank you.
Hi, I'm Jackie. I run the South East Support Group for Annabelle's Challenge, and I'm also on the Emergency Care Working Group. And my husband Andy, who you saw earlier, has just joined the Board of Trustees. Our son George was diagnosed age 7 back in 2005, and so we've had lots of practice going to A&E, and I'm just going to talk to you about emergency preparedness, and I think you can get most of this information from Annabelle's Challenge as well. So first off is the ambulance marker, absolutely essential. Had to chance to use it last week. This gets attached to your home, work or school address in the event of emergency, and the attending crew that to that address will then be aware of the diagnosis, and this may result in a more targeted approach. You need to tell the call handler when you ring that there's an emergency marker in place. They don't always see it. I also have an emergency pack which is ready to grab at a second's notice. It's got George's name, date of birth and NHS number on the front, as well as on all the documents inside it. We also have copies of all the documents in it on our phones, and as mentioned, some people use a phone app. We found doctors very open to being emailed information, and so keeping things on your phone is really, really useful. In the pack, we start with, we have a to who it may concern letter specific to George, written by his GP, or it could be from your main consultant. It's the first thing I show the emergency department medics. It's from a fellow health professional. It gives a diagnosis, any complications, key consultants, etc. It gets the most pertinent information across very quickly, and we find it's always taken seriously, more so than me kind of come running in and saying, he's got this, he's got that, he's got... Read the letter, it's all there, signed by a doctor. We give the medical alert A4 sheet for medical professionals, which has come from the EDS National Diagnostic Service, or the blue wallet card, which you can keep on you at all times. But the A4 sheet I actually have multiple copies of, which I hand out to medics. That means that they can keep the document, and it means that they read it properly rather than just skimming it and handing it back. They've got it for reference. And on the back of it, I've listed all the consultants who are available to contact for further advice. So it's all there on a sheet, and they can keep hold of it. And then, depending what's been happening recently, within my pack I may also have copies of scans, discharge letters, whatever's been going on, as an up-to-date sort of history that we can show to medics. So it's desirable to have somebody with you to advocate on your behalf when you go to the emergency room, but it's not always possible. So we would also suggest wearing a medical alert disc or bracelet, which attaches to your ID to the medical record. And these are discounted through Annabelle's challenge, so all the information is on their website. And then lastly, you need to spend a bit of time preparing how you're going to approach an emergency situation. You need to think about what you want to say, how you want to get it across. And what you're aiming for is collaboration rather than conflict. So we offer to share information, and we try to ask questions rather than demanding. So the sort of thing we might say is, would you like to know what's helped in the past? Would it help you to contact the specialist for some more information? Do you think that this is wise given the extremely friable nature of my tissues? And George even said to one trainee doctor who was struggling with the tourniquet, are you sure you want to practice taking blood on me? that non-confrontational, encouraging collaboration. Good luck.
Big thank you to Jackie and Gemma for doing that so eloquently, and I will endeavour to do the same. We looked also, with the questionnaire, we also looked at the fact that in order to be your best self-advocate, it also helps to optimise your physical and mental health. I know when I'm in pain or I'm extremely fatigued or I'm particularly anxious, I find it a lot harder to communicate and advocate for myself. So we asked, one of the factors that featured in that was being part of a community and the impact that had on your mental health. So how does being part of the VEDS community help? And the irony of me standing here saying this is, although I've been to one other conference, this is the first time I've actually directly spoken to or had contact with anybody with vascular Ehlers-Danlos. So but I'm now going to tell you how being part of the community is important. The feedback you gave us was that it gives you confidence, you feel you're listened to, you create connections and friendships, and you get to share knowledge, and there's an understanding, particularly when you have a rare disease, and there's that camaraderie and learning from others, friendship and support. We asked you what you do to optimise your mental health, and like I say, connecting with others was part of that, whether that be through social media such as Vascular EDS Facebook groups or in-person support groups. As well as the positives of being part of the VEDS community, you also told us about the hard times as well. I think it's important to acknowledge that it's not always easy, but overall, you've said that the pros outweighed the cons, and as one of you said, it would be harder not to be part of the community because I am stronger with it. In addition, it's not just the Vascular EDS community who provides support. You told us how important it is to find family and friends. I brought my friend with me today for backup to talk about how you're feeling and ask for help if you need it. We also we asked you about tips on how you manage your mental health. You also told us that you allow yourself time to grieve and feel sad, and to talk about it, but to try and balance with it by finding things to feel grateful for and doing things that you enjoy. You told us, try and live in the moment as much as possible, and that you have to learn to let go of disappointment when plans get cancelled, but that you don't allow that vascular EDS to be who you are, to define you, but you don't fight each other either, and acceptance is an important part. Many of you talked about how helpful it has been to get professional support for mental health. From my personal experience, that's something I've struggled with. I've found that medication is helpful, and I think initially there's that feeling of that, seeing that as a weakness, but to reassure you it's not, and I think there's so many people in our situation who need to access mental health support when you're living with something that is so uncertain and can be quite frightening. So, but obviously mental health is something that's going to be talked about later on. Another part of benefit, another thing that could benefit your mental health is sharing your story. So as well as being a means of self-advocating for yourself, it can also have benefits for you personally. My experience of sharing my story was that I had a series of misdiagnosis and A&E. So I'd had major vascular complications, and whilst the doctors were doing all the right things, they would then send me home whilst I was critically unwell. So as a result of that, I started to write down what happened to me, highlighting the problems that people with vascular Ehlers-Danlos are facing in an emergency situation, and I shared that. And for me, it wasn't just about raising awareness, it helped me process and organise what had happened to me. It then meant that when I was in that situation again, I could be clearer when I was advocating for myself, as well as it being quite cathartic as well. And it got quite a good response. It was published in professional newsletters and things, so that was quite useful. But on the flip side of that, I've also found it really helpful to hear other people's stories. I'm fairly new to the vascular EDS community. Although I was diagnosed in childhood, I didn't want to know other people with vascular Ehlers-Danlos. The concept of that was quite frightening. It felt like it would be holding up a mirror to my life, and that's something I didn't want to think about. But in recent years I've become more involved, partly because of wanting to raise awareness, and partly because I found that hearing other people's stories makes me realise that how I'm coping with it is okay actually, and I'm not doing too bad a job. So I particularly enjoy listening to Katie, who's a person with vascular Ehlers-Danlos who lives in America, and I was listening to when she was talking about mental health, and she was talking about how it impacted her behaviour, and habits. And I showed it to my boyfriend, and I said to him, he watched it, and he was like, "You do that?" And I was like, "I know, it's okay, it's normal, I'm not going crazy." So it helped in that respect. As part of the emergency care project, we're looking at opportunities for members of the vascular EDS community to share their story, because I think the power of patient story is so important, it's what really sticks in professionals' minds. You know, I've heard professionals say this to me quite frequently. So we're looking at opportunities, exploring that to try and highlight some of the problems that people are facing, not just in emergency care, but generally, so that we can try and improve the patient experiences as well as health outcomes when people are accessing emergency care. So yeah, I think when I started it, I felt like, could, as one person telling a story, could I make a difference? But I do think we can. And as well as being one person, we're not just one person, we're part of a community, and I think that has a great deal more power. So, and even if you don't want to share your story, like I say, there are the benefits to you of just writing it down and that being something that's helpful, particularly after something traumatic. We also included questions about your physical health. Reason being is obviously that can impact your mental health, and we didn't feel like we could separate the two. So you recommended light gym. I think I missed it anyway. We very one moment. Yeah. So I think one of the things I missed, was that, no, right, I haven't missed it. Yeah, so the physical bit, we talked about like you recommended like the gym work and aqua workouts, you enjoyed cycling, you look forward to gentle ballet and ballet bar. Many of you talked about the benefits of Pilates, and I think Janice Brown put this so well. She said, I can honestly say that Pilates has literally held me together since my diagnosis in 2011, and exercise is not optional and must be done to keep the muscles strong, doing the job that our collagen can't. And I can vouch for the lack of exercise not being very helpful. So I know myself that it's difficult to reverse problems or damage to your body, even when that comes to fitness and weight. And so with the fact that we can't be so easily fixed, a preventative approach is definitely better. You talked about pacing yourself. You said not to do something you know you shouldn't just because you feel frustrated with your limitations. And very wise teenager told us, don't be like me and overdo it, and then suffer by having to have a couple of days rest. Plan your time wisely. For example, if you go out on a Friday night and don't plan anything too tiring on a Sunday. Also remember you have your own pace. So try and learn when your body says no. Sleep is key along with rest. And then physical well-being also extends to our school, college, work life. It is important to advocate for ourselves and get support where needed, such as asking for flexibility and variable hours if needed. Abigail told us, I have an independent learning plan at university that accommodates the condition. I have longer deadlines to help with fatigue and other issues, and flexibility to attend appointments. For the people who experience fatigue and flare-ups, you suggested taking regular naps, telling people, including employers, that you have chronic fatigue, and not just that you were tired. I know my nieces and nephew, when they were little, if I ever left the room for any time at all, when I came back in, they would say to me, did you go to sleep? Have you been to sleep? So yeah, it's a common problem for all of us, isn't it? You also told us a range of great ways to boost your mental health, from cinema, movie nights, games, dinner with friends, gaming and piano, arts and crafts, sailing, spending time with your pets, escape rooms, painting, reading and cooking, and going to the pub. Many of these activities may be suitable for children, possibly not the alcohol, and parents and teenagers made further suggestions for child-friendly activities. Activities such as movie making, photography, Lego building, arts and crafts, hiking, camping, and definitely baking. We also have some future engineers and programmers amongst our community. Thank you.
Thank you so much. So in summary, it's literally the last minute or two of this workshop. We can't change what we were born with. We have no control over that, but we can choose what to put into our jar of life, what learning to put in, what knowledge to put in, how we relate to our healthcare professionals, how we share with each other, how we connect to each other, how we keep ourselves strong through mentally and physically, how we give ourselves the best chance to be good self-advocates for ourselves, how to stand up for ourselves and make our needs known. So I hope this workshop has shared with you just a few meaningful, life-affirming and positive ways and things that you can put in to fill up your job. And I hope that you'll help us further by filling out, it looks like this, the form on your tables, and really please add your suggestions to the mix. I just wanted to take one more minute to say thank you so much to our incredible speakers, unbelievable advocates and examples to us all, as all of you here are today. Thank you very much.